right, we're joined now by the Minister of State for Health, Dr. Tunji Alausa, to discuss more on government's plans in the sector, as highlighted from that report by the Coordinating Minister of Health and Social Welfare. Yes, you saw him in that report by Olije Wapera. So good to see you, Mr. Minister. Now, where do we begin from? Let's start with the figures first and the numbers, the money that's been released, 50 billion naira first tranche, to address basic health care in Nigeria. First off, how exactly will the funds be deployed, and what systems do you have in place to ensure that these funds are judiciously, deployed?
Yeah, thank you, Ngozi. This President Bola Ahmed Tinubu, made several campaign promises to Nigeria, and I'm happy to tell Nigerians today this president is delivering on all his campaign promises. I know things are hard in the country, but we just need to be patient. This president is about sustainability. It's not about patchwork. It's not about superficial work. This president is fixing Nigeria from ground up so that decades from now, we'll have a resilient economy, we'll have modern infrastructure, corruption will be a thing of the past. So I'm imploring Nigerians to be patient. This president knows exactly how he wants to fix this country, and he's working hard to do that. We can see what he did in Lagos State. Lagos State, we're all living witnesses to the development in Lagos State today. Now, let me tell you about the 50 billion naira from our Basic Care Provision Fund. Now, it's 1% of the consolidated revenue that goes to our Basic Care Provision Fund. We're mobilizing 50 billion naira, double what the entire money that was directed to our primary health care center in 2022. This fund will go directly to providing services, manpower, equipment, pharmaceutical at our primary care centers. We have a ministerial oversight committee. What was lacking before? Basic care provision funds were disbursed to our primary care centers. There was no return being made on how those funds were spent. But now we're putting processes in place that each primary care center that gets this fund, before the next tranche of fund is released to them, they'll give us a full return of what the initial money that was sent to them was used for. So the process will be more tightly monitored because we want Nigerians to have meaningful and comprehensive health care. That's what the president wants, and that's what we're doing at the Federal Ministry of Health. We have commitment, we have responsibility to Nigeria, the Nigerians.
Okay, Dr. Alausa, let's now start talking about specifics, which I know is of immense interest to you and Nigerians. Let's start from the grassroots, the primary health care, which we understand before now has been in a very bad shape. What is the government doing in the last 9-10 months?
Thank you, Suleiman. In the last 9 months, we're revitalizing our primary care centers, rebuilding some of them, putting infrastructures in several of them. And in the last 9 months, we've hired over 2,700 health personnel, including doctors, nurses, midwives, community health extension workers in our primary care centers. The primary care system is the base of our healthcare system. We're strengthening that core of our healthcare system. And now, if you see what we're doing with immunization in the last 9 months, over 5 million children have gotten the Penta 5 vaccine. 12 more million children have gotten the TD vaccine. And we've also hired 1,400 more facilities now have skilled birth attendant that is attending to our pregnant women so that we can begin to turn the corner on the high mortality rate that we have. We've also, in the last 9 months, over 550,000 more pregnant women are getting their antenatal care earlier in the course of their pregnancy. We're making tremendous progress in the health sector.
All right, great. Let's, for these moves to work, to succeed, you need practitioners, healthcare practitioners, very vital to the healthcare sector. Resident doctors, about 1,417 of them left the shores of this country. What are you doing to reverse this, what we've come to note as the Japa syndrome? And 9 out of 10 medical and dental consultants actually leaving Nigeria. What are you doing in specific terms to reverse this trend?
Thank you so much. We're addressing this with a multifaceted approach. Now, we have a big population of over 200 million people. We need to leverage this population, and that's what we're doing. I'll list several things we've done quickly in the last 9 months. We've doubled the enrollment in our medical institutions. We've doubled the number of students being admitted for medicine, dentistry, pharmacy, medical laboratory scientists, nurses. In medicine alone, we're enrolling 5,000 students for medicine. Now, we've doubled to 10,000. With nursing, before we came in as a government, we're only enrolling 28,000 nurses. Today, I'm happy to report to you that we're now enrolling about 68,000 nurses in our nursing school. Before the end of this year, we will be enrolling over 120,000 nurses. We know people will leave, but we need to increase production. And you've heard the president say that. We're aggressively increasing production. Beyond increasing production, we also have to put strategy in place to retain. That's what we're building. We're improving infrastructure in our in our hospitals, from primary healthcare center to tertiary hospitals as well. We're equipping our hospitals with modern equipment. And then the president is also working on a comprehensive plan to improve welfare packages for our healthcare workers and more so for the entire workers in the country. So as we continue to do this, we would leverage the opportunity we have from our diaspora as well. We're talking to diaspora. I had a big meeting with a diaspora professional just last Saturday. Now we're encouraging them to also come in and help in participating in the expansion of our medical education, coming and bringing the expertise to bear in our hospitals as well. So we're approaching this multifaceted approach, and the president has been very determined to support us. If you look at this 2024 budget, this is the largest budget in health that we've ever had in the country. I know we're not at the 15% of the Abuja Declaration, but compared with the quantum of money that the president has budgeted for us in the Ministry of Health to improve infrastructure, to buy equipment, and just last week, the president approved the building of 6 cancer centers and 9 diagnostic centers.
Let me jump in here.
That the president will be launching.
Let me jump in here, Dr. Alausa. Listening to you, I think Nigerians will not excuse yourself and Dr. Pate if you really don't bring the diasporan community to help because of your track records having been there. Now, quickly here, let's talk about vaccine production and some production of the PPEs. Are you looking in that direction to open the space just as we've seen India going?
Yes, we're domesticating our pharmaceutical manufacturing in the country and medical consumable. What happened in the past is that the law that we have has not protected our local pharmaceutical companies. What we're doing now, we're reviewing our pharmaceutical laws and policy, and then to come up with more comprehensive plan to protect our economy, to protect what currently exists now. You have local importers of drugs and medical consumable, multinationals. They just continue to import. If you go to other countries, even Algeria they have a 5+5 rule. You import after 5 years, you have to domesticate your production here. And that's where we're going to, that's what we're doing. And if you see our medical industrialization plan, we will build medical industrialization up in each of the 6 geopolitical zones of the country. We're talking to Afrexim Bank, we're talking to other multinationals, mobilizing foreign money to come in to support domestication of our pharmaceutical industry. As you can see, you heard the coordinating minister said we already have 3 commitments, 3 large pharmaceutical companies coming in to start production. We have one that is starting production. We're working with them to have their PQ, where our development partners can begin to purchase the product they're making in Nigeria. We're also working with NAFDAC. We've got into maturity level 3, ML3. We're working to get to maturity level 4, ML4, where NAFDAC can actually vet medicine that's produced in Nigeria. And once we get to that level, those medicines can be exported to any part of the world. And we're also working with looking for contract manufacturers, talking to people in India and other places to bring contract manufacturers in to help support our local agenda to domesticate our pharmaceutical production in the country.
Right. Fantastic, Dr. Tunji Alausa. I hope you're planning also to bring back the pharmaceutical companies that have left the shores of this country already and making drugs very expensive. In 30 seconds, you want to respond to that?
Yeah, of course. They left. We're talking to them. We just met. There was a meeting that the Party attended just in Brussels a few weeks ago. We met with 8 of these multinational pharmaceutical companies. They've shown interest in coming back. The environment is different now. We have a president that is fixing this country bottom up. They are actually interested in coming back now. So I think we are on the path of sustainability. Things are a little bit hard now, but they'll continue to get better in the not too distant future.
Well, that's a fine place. Well, I'm afraid we're out of time. It's a fine place for us to leave it. Dr. Alausa, many thanks for speaking with us, the Minister of State for Health.